In Kenya, healthcare access is still out of reach for many, and if accessible, the cost is often prohibitive. However, experts back the country's high mobile technology adoption to play a significant role in bridging healthcare inequality through improved access, speedy diagnosis, and reduced cost, which accounts for almost half of household income. With 62 million mobile subscribers representing a penetration rate of 130.3%, Kenya has the highest mobile adoption in Africa and is among the highest in the world. One company is now leveraging on these statistics to bring critical healthcare services such as X-ray and ultrasound to those who need them.
When I was working, I realized that the patients were not involved on what was happening. So I thought of it and I say, okay, what if the patient knows what is happening? If we were doing an ultrasound, for example, we are able to tell the patient, yes, this is what we are doing and this is what you can see. And even if the patient may not really understand, there is that feeling that the patient will feel like, oh, I am included.
Today we meet Joachim Choge as he heads to a local healthcare facility located about 20 kilometers from the Nairobi Central Business District. For him, every second counts, because sometimes that is what determines life from death.
Kuambia daktari naelekea Kayole Junction. Nimesuspend ya donom of which alikuwa before you.
Time is of an essence to his business that we do the interview while on the move, but his 5 mobile phones won't stop ringing due to high demand.
Restriction of movement. There are inbound home patients. There are facilities that have come up with ICUs just to try to solve the issue of COVID-19. And once they have set up their ICUs, they actually don't have X-rays. They don't have portable ultrasounds. So it has impacted in one way or another because it has increased our demand and made the facilities also that outsource the services from us to know us, because with a patient in ICU, we can actually deliver an X-ray to them. Whether the hospital has it or it doesn't have it, we can deliver from their bedside on oxygen or whatsoever. And for your information, almost 60% of the X-rays ordered, we don't miss a COVID patient.
He is in a rush hour, but the notorious city traffic stands in his way. At times, he is forced to drop some requests. It is for this reason that he had to start Jone Ultrasound Services.
The product designed by Jone is actually focuses in at least the 3 pillars of healthcare, which is accessibility, affordability, and accuracy of diagnosis on time. You realize that there are places that are they cannot access the service, like in the slums. Nobody is willing to invest radiology center in slums, and that is what we have seen as a major. You go even to a place like Kibera, there is no radiology center. All of them are actually in a big place like Upper Hill, others are in town. Now there is this patient who seems to have been forgotten in the slum. So we go for them. Now that is us. We are going to answer that problem that they face.
Currently, an X-ray costs an average of 2,500, and in the informal settlements, that is at least 10 days of meals.
2,500 for someone in a slum, that will be a pipe dream. Actually, it will be for those who are able to pay. So we try to bring our prices a bit affordable to them by charging at approximately 1,800, and we deliver at home. So the affordability is answered in a way that the patient will not have to spend on fare. And that means if, for example, we do for just an average cost for accessing an ultrasound in Nairobi, you are in Kibera, you are going to Upper Hill, you are going to do a scan 2,500, you have used a fare of around 100 bob or 200, and then back 200, that is around 400, 500. So makes the cost of that scan at least 3,000. That is before even consulting with a clinician. So you realize that at the end of it all, if a patient decides to go for such a place for a scan, that person must be having an average of 5,000 in his pocket. If you cannot have that amount, then that person will likely not get the service.
Official statistics indicate that only 19% of Kenyans are covered by any form of health insurance. In poor households, health insurance coverage is just 3% compared to 38% among the rich.
For those patients who cannot access insurances, this is actually their answer. Yes, this is actually their answer, because we are able to travel to wherever they are. And in Kenya actually, we really need such as this, even more, because of our 40 million population, with just a single mobile ultrasound or X-ray service provider is really a drop in our ocean.
By reducing radiology services by almost 30% and making it easily accessible, simple life-saving services have become available to patients. 30 minutes later, we arrive at this facility and Joachim and his assistant are quickly ushered into this room.
Accident patient, so we need to check whether there is any issue. Alright. Kama kuna issue, ataenda nyumbani tu.
The clinic ordered for a spinal X-ray for this man who recently had an accident. Within 3 minutes, he completes the setup with this portable gadget.
It's a lead protective sheet that will help us protect staff and any other person who's doing the X-ray, so that at least we are protected, because most of the time, yes, now we can go outside.
The portable device gives instant result, enabling the health officer to give further advice.
For a good treatment, we always need to understand the cause and everything, so it is part of an investigation. So it's very impactful because we need to understand the damages and everything about it.
Cost and space are two major reasons X-ray and ultrasound equipment are not available for such small healthcare facilities.
It's really helpful and we really appreciate their services, considering that we not yet have expanded to having such instruments or things like that in our facilities. So it's really helpful because it's fast and affordable to the clients.
Esther, the clinician, tells me how the mobile Medicare solution has been key in patient diagnosis.
We have big hospitals around, but considering the amount of time they need to go and make the lines and order things around, so it makes it much faster for us to order and for them to just bring the instruments here and just do the test here.
Joachim hopes such services will be critical in improving healthcare access in the country and reduce deaths related to accidents and childbirth complications.